Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and life as a new dentist. Ladies, gents, it's a new year, which means new things to be thankful about, but also new things to put on your action list, right? And hopefully, it's one of those things where those things that you're trying to do or that you want to do, you get some tips, you have some actions, you have some strategies, and that's what this episode is about. So be sure that you are continuing to tune in, share, like, comment, and let us know and give us some feedback about things that you want to have us talk about upcoming in this year's set of episodes. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidencyChallenge.com. Yes, a challenge. We challenge you to challenge yourself to jumpstart your residency process, so that your residency application process, so that you are not surprised, you're not fearful, you're not doubtful about how you should put your application together, so that you do two important things, which is get attention and then get invited to interviews, but also get selected this application cycle. For more details, go down below or up top, which is GetIntoDentalResidencyChallenge.com, and we'll see you in the next challenge. So today we're going back to the West Coast. We've had some successful not success. Yeah. There've been some successful actions that people have been implementing and celebrating and getting into residency. Today we're talking with D4, about to be Dr. Isabella idea. And Doc, please introduce yourself for those that are meeting you for the first time, and just give us a little bit about your background as well.
Awesome. Hey, everyone. Thanks first and foremost, Dr. Darwin, for allowing me to be a part of this process, for aiding me through this process. My name is Isabella Cecilia Dumlauidea, but you can call me Bella for short. As Doc said, I am a fourth year at Loma Linda University School of Dentistry. I did get my Bachelor of Science in Dental Hygiene from that same university, and I practiced as a hygienist, a registered dental hygienist, for about a year before I did go back into the DDS route. And now I really can't believe it. I'm 4 months away from graduating, and just got through that very challenging but rewarding process of match into a pediatric dental residency here at Loma Linda University School of Dentistry once again. I can't
Awesome.
believe it. Yeah.
Yeah, you are glowing, Doc. You're glowing. You're glowing. I mean, not that
Thank
you weren't glowing
you.
before, but you got a special glow now because you got this, you know, one step closer to becoming a board certified pediatric dentist by Matchins. I want to say congratulations, and we want to know all the things and how you did it. So let's get started. Let's just jump in. Uh, Pedo. Why pedo? Why not ortho or oral surgery or just general dentistry? Why pedo?
I think I always take it back to my origins. I think of my family and of community, and I think it's not to say that any other, dental profession specialty area doesn't work with community, but I feel that with pediatric dentistry, the privilege to be able to bring a lot of my own sort of cultural values of taking care of not just one's own, but those around you, in order to build a better foundation for your community as a whole. That starts from working with our very young ones, and with dentistry and setting up the foundations of health through the oral cavity, which is still very much a part of the body, and creating good relationships with our community through being an educator and someone who can just very uniquely and be very specially trained to inspire and work with those who are ex especially vulnerable, and those are the children of our society. I do feel that that has always been my calling. I'm the eldest in my family. I'm first generation Filipino American, in our culture, we always think of the others in our community as almost like our family. So even if my auntie isn't really my blood auntie, she's still auntie to me, you know. And being from a Methodist, you know, faith too, our mantra of open hearts, open minds, open doors, that's also been kind of a big inspiration to what my passion and what my calling is, which is to always welcome others from all walks of life and to, you know, especially, you know, touch or impact them in a way that will leave them better than when they first came to be in contact with me. And I think through pediatric dentistry, that is a very important part of our society that is so needed, and there's so many underserved folks that need that care from the very beginning of life. And in a nutshell, that is why pediatric dentistry is for me.
Yeah, that's great. That's great. And I love
Thanks.
that because, life starts as a kid.
Yes, yes.
Right?
Yeah,
Life starts
we all start
as a
that way,
kid,
you know?
which is cool. I forgot to show off a little bit of my what was it Tagalog? Is it
Oh,
Tagalog? Did I
Tagalog,
say it?
yeah.
Tagalog?
Your Tagalog
I was
chop.
supposed to greet you today and say "Kamusta." I was about to
Yeah,
ask you
kamusta ka
"Kamusta."
na?
Yeah, I forgot, but I guess I got to do something else later on. But yes,
No, it's all
Pedo,
good.
sense of
Yes.
community and family, it
Hmm.
being your calling, and it's a story for you, right? It's a
Yes.
lifestyle.
Hmm.
And for many people who are applying to pedo, it may be something similar, it might be different, but it's a story, right?
Hmm.
And
Hmm.
it's your story, and it's one of the things that people have to continue to remember as you're putting together your application. You want to tell your story, right? Know your
Absolutely.
why. What are those most important things that have pushed you down this pathway, so to speak, right? Um,
Yes. Yes.
there's also a pathway of getting the application together,
Hmm.
right? Tell us a little bit about your strategies and how you went about getting your application together for Pedo.
You know, when I was really reflecting on this, I realized that I called this my calling, right? It really was like that. I was someone who had always loved working with kids, but I didn't realize that it was going to be in pediatric dentistry specifically someday, that was how that was going to be realized. But way, way back in the day, I was like a high school student and I thought I was going to go to a university, study biology, go the DDS route, and then get to peds that way. That is not how it happened for me. I actually did community college first. I got waitlisted to all my universities that I applied to as an undergrad student. And from there, I then did the hygiene program at Loma Linda. And that is kind of like the first foray into what sort of sparked that interest for me. So I feel like in a way the preparation and the mentality behind like someday I'm gonna get there. There's something kind of brewing in my heart, incubated deep down inside that makes me feel like I feel like I can do this. I just need to find my way. And so I think it always went down to who is it that I can talk to that can teach me about just being in contact with those who need that kind of care. I got really involved with multiple service organizations, one of which is very near and dear to my heart, being Healing California. I would say it started as early as that as a hygiene student. You know, providing that service in Honduras when, you know, I got to do that as a mission service. And we served half of our patients who were like, I think 500 patients in the totality of like a week. It was just me and like seven other dental students when I had first done this as a hygiene student. Half of those patients were kids, and my colleagues did not like working with kids, but I did. And I felt like, wow, if this is something I want to do someday, I definitely want to get more exposure. And I think from there, I sort of had this mentality that if hygiene isn't for me, maybe I can go into dentistry and see how that works. And then COVID happened. I graduated 2019 from my bachelor's program for dental hygiene, worked a little bit, and then COVID happened. And that was kind of my sign. I'm like, you know what? It's now or never. I'll apply to dental school. And I think from then, I actually thought to myself, you know, I'm going to try to solidify myself as a, you know, very hardworking student, maybe make my name known, and even the pediatric, you know, specialty portion of our school and kind of get to know the faculty there. And I just felt like I was always somehow drawn into whether it was just like, oh, we need help passing out like toothbrushes to this local elementary school or something. I think I always made a point of like not being a stranger to those around me, whether or not they could quote unquote help me or not in this process. I think again it goes back to community. And I think when you're asking the formal question of like, how did I prepare for this? Obviously, I did my research. I went on Google. I the usual channels, Reddit. Like, okay, who can tell me like kind of their strategy for like what their timeline was for how do you get into peds like in the practical sense. And a lot of the general thing is get a good GPA, talk to the powers that be, things like that. But I think obviously, Dr. Darwin, you helped me so much with that process too. You gave me like a really good timeline for how to get my thoughts together. As you can maybe tell, I tend to be a very sort of conceptual, ideologic sort of person. So having a timeline really helped me a lot, and having those goals really helped me look not just like missing the forest for the trees, sort of, but like making sure that anything that I did kind of always tied back to that ultimate goal of becoming a board certified pediatric dentist. So if I was doing service work over the weekend, I'd make sure, okay, it's because it's going to help get me a lot more experience working with kids, especially since it's at an elementary school. Why am I studying so hard for this test and missing out on parties with my friends? Because I want to do the best that I can to prepare for, not ever having an excuse to not do my very best in order to present myself the very best for that application process, should I feel that I'm ready to do that. And in all reality, you're never really ready. You kind of just it's consistency and it's intentionality. And I think those are kind of the general ways that I prepared for the application.
Yeah, and I think you made a good point. You many may feel like they're not ready,
Hmm. I didn't feel like I
and
was.
and you don't really, you know, you can't confirm that unless you get ready and apply.
Yeah, you just got to put yourself out there. I think that's like kind of the key with a lot of things. Um, like speak even though your voice shakes was kind of my big mantra for this time was that just you just got to do it. Like there's always going to be a first time, and you'll never get to where you want to be unless you take that first step.
Yeah, I mean, just like, for us getting ready for dental school, that first week, that first day, it's
Hmm.
like, oh my God, am I gonna be ready? Well, guess what? You paid your deposit, moved, relocated, and you're starting in the morning. So if you ain't ready now, you ain't ever gonna be ready. So
Hmm.
just go to class. Don't worry about it, right? You
Yeah,
just have to
yeah.
just have to jump in. What's the best way for people to contact you if they have some more questions?
You can contact me at my email. I'm usually pretty good about that. It's just my name, Isabella.cd.idea, like I have an idea, at gmail.com. That's a really good way for me to do that.
There you go, right there. Isabella.cd.idea
At
at
Gmail.
gmail.com. We'll put
Hmm.
that down. If you guys look down in the narrative and also on the screen here, you'll see the correct spelling. Well, again, congratulations. It's
Thank
been
you
a
so much.
process. It's been a
Yes.
process to a successful match in pediatric dentistry, and you are on. Well, you've been on your way to
Yeah. Oh,
Pedo. This is just more of an official notification of you matching, right? Of you matching into
yes.
Pedo. So continued success to you. We'll keep in touch, especially after the first, or maybe before the first year, just to see how you're
Yeah.
surviving Pedo. Because the hard part, well, the easy part is done, right?
Yeah.
It's getting in. It may not seem
Yeah.
easy, but now it's time for the hard part. Now you got to get through it.
Getting
Now you
out.
got to survive. So we want to make sure and check up on you, make sure that you're surviving and doing well. So again,
Yeah.
thanks and continued success to you. And to you that are listening, to all of you that are listening and watching, go to the next episode. Go to the next episode right now. Go, go, go.